Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. Today we are going to talk about drugs known as opioids. Opioids simply are drugs for pain management. Usually we use opioids for the management of moderate to severe pain. What is pain? Pain normally is an unpleasant feeling, a kind of feeling which will not be liked by the patient. So as a physician, it becomes quite very important to be able to manage different kinds of pain. It's going to be important for you to be able to alleviate the pain from the patient. How do we approach pain as a physician will become a big challenge in the field of clinical medicine, because usually your patient will present themselves with different kind of pain. Normally, pain is subjective. It is felt by the patient alone. And as a physician, you have to be in a position to identify what type of pain your patient is suffering from. Is he suffering from mild pain, moderate pain, or severe pain? And there is no a device that measures the intensity of the pain. So you only need to rely on your patient. One of the ways in which you can identify the intensity of the pain of your patient is through communicating with the patient. You ask your patient, how are you feeling? What is the intensity of the pain you are feeling? It's important. You communicate with your patient. Some of the other ways in which you can identify the intensity of the pain include posture and attitude. What is that? You can identify from the face of your patient. If your patient is sweating too much, then you can realize that that kind of pain must be some kind of moderate to severe pain. If the face of your patient is presented with frowning, it could be a severe pain. You also need to understand that pain from MI is usually severe. Pain as a result of colic is usually severe. So severe pain should be identified from moderate and mild pain, because normally mild pain can be managed with NSAIDs. So simply mild to moderate pain can be managed with NSAIDs, while moderate to severe pain can be managed with opioids. You see, mild to moderate pain can be managed with NSAIDs, drugs known as non-steroidal anti-inflammatory drugs. Moderate to severe pain can best be managed with opioids, a group of very important drugs which we are going to discuss today in details. What you also need to understand as a physician is that the kind of pain your patient will present with include nociceptive pain and neuropathic pain. You have to understand too, because some drugs work better with nociceptive pain, other drugs work better with neuropathic pain. So pain, you can classify into nociceptive and neuropathic. Nociceptive pain usually is a kind of pain that results as a result of tissue damage. When tissue is damaged, normally what happens is that receptors for pain will be stimulated, known as nociceptors. So let's assume this is a receptor for pain. This is a nociceptor. The cell body for this nociceptor is usually located in the posterior root ganglion. Posterior root ganglion. When tissue is damaged, what can damage the tissue? Tissue can be damaged by mechanical factors. Tissue can be damaged by thermal factor, increase in temperature, for instance. Tissue can be damaged by chemical factors. Anytime the tissue is damaged, these receptors, known as nociceptors, are stimulated. When the nociceptors are stimulated, there will be the transmission of electrical impulse along the peripheral nerve. Along the peripheral nerve. So this nerve extends up to the spinal cord. This nerve, at the level of the spinal cord, when it is stimulated due to tissue injury, will release neurotransmitters such as substance P. This neurotransmitter, known as substance P, sometimes even glutamate, can be released as a neurotransmitter by nociceptive neuron. So when substance P is released, substance P will act on other neurons in the dorsal horn of the spinal cord. That other neurons include neurons which are found in the substantia gelatinosa. Alright, now we assume this is the dendrite of a neuron in the substantia gelatinosa. So this substance P will stimulate this neuron. So the first neuron is known as first order neuron. It is this neuron that has been stimulated as a result of tissue injury. So this substance P released by the first order neuron will activate the second order neuron, which is found in the dorsal horn of the spinal cord, the dorsal gray column. All right. When substance P stimulates this second order neuron has got its axons extending up to the higher centers of the brain. The second order neuron extends its axons as normally lateral spinothalamic fibers and go to the thalami. It will go to the reticular formation. Some of the fibers will go to the limbic system, and some of the fibers will go to the cerebral cortex. When these fibers reach to the higher centers, that is when the pain will be felt. The axons of the second order neurons reaches the higher center of the brain, such as the thalami, the limbic system, the cerebral cortex. That is when the patient, or that is when the person feels pain. Okay? Pain sometimes can have emotional factors as well. This will occur when some of the second order neurons and other third order neurons reach the limbic system. So nociceptive pain usually occurs as a result of tissue damage due to mechanical, thermal, or chemical factors. And nociceptive pain, as I have said, is usually mediated by neurons, which is connected to nociceptors, which are located mainly on surfaces like the skin. I say the first order neuron wuxuu deenaya substance P. This substance P wuxuu stimulation ku sameynaya second order neurons oo laga helayo spinal cord. Okay, the second order neuron axonkiisa wuxuu aadaya higher centers of the brain, including the cerebral cortex. Markaas bay dhacaysaa qofka inuu dareemo xanuunka. How about neuropathic pain? Neuropathic pain normally wuxuu yimaadaa when there is damage, okay, to the neurons involved in the transmission, reception, and interpretation of the pain. Maxaan ka wadaa? Neuropathic pain wuxuu imaanayaa markuu yimaado what do you call nerve damage. Markuu yimaado damage to the nerve. Nervekii qaadi lahaa painka. transmission ku sameyn lahaa baa damage ku yimaaday nerfkii gudoomi lahaa baaqi oo laga helayay maybe in the spinal cord baa damage ku yimaaday nerfkii sameyn lahaa interpretation maybe laga helayay higher centers like the cerebral cortex baa damage ku yimaaday anyway when there is damage to the nerves involved or to the neurons involved in the transmission, reception, and interpretation of pain, that is when we can have neuropathic pain. Nociceptive pain, markay bukaanada kula yimaadaan maxaa lagu garanayaa maybe xanuunka ka cabanayaan waa wuxuu leeyahay character such as aching pain, such as throbbing pain. So kan wuxuu kula imaanayaa things like ache, okay, throbbing. While bukaanada kula imaanaya neuropathic pain waxay kula imaanayaan things like burning sensation, electric sensation, why am I trying to classify pain into nociceptive and neuropathic pain? Because the available drugs we have usually qaabkay u wajahayaan this pain way kala duwan tahay. Nociceptive pain waxaan ku daaweyn karnaa NSAIDs-ka, alright, to some extent hadduu moderate to severe u yahayna waxaan ku daaweyn karnaa opioids. While neuropathic pain, this kind of pain waxaan ku daaweyn karnaa isagana opioids-ka, laakiin waxaa ka fiican daawooyin lisku yidhaahdo anticonvulsants-ka like carbamazepine, alright, waxaa ka fiican daawooyinka antidepressants like tricyclic antidepressants like amitriptyline, waxaa ka fiican daawooyinka antidepressants like serotonin, norepinephrine reuptake inhibitors like venlafaxine, duloxetine. So waxaa ka fiican simply anticonvulsants iyo antidepressants. Anticonvulsants and antidepressants baa ka fiican when we are dealing with neuropathic pain. Otherwise opioids kana waa la isticmaali karaya. Having said that, let's now try to understand that our body has got its own mechanism for modulating pain. Our body do have got its own mechanism for modulating pain. Our body have got neurons that releases endogenous peptides. These endogenous peptides of the body include endorphins. So endogenous peptides waxaa ka mid ah endorphins, waxaa ka mid ah enkephalins, waxaa ka mid ah dynorphins. Alright, these peptides waxay awood u leeyihiin xanuunka uu qofku uu dareemayo inay hoos u dhigaan. Endorphins, enkephalins iyo dynorphins. These are endogenous peptides. They are sometimes known as endogenous opioids. These peptides waxay leeyihiin receptors of their own. Receptorkooda maxaa la yihahdaa endogenous receptors, or what you call opioid receptors. These receptors waxaa ka mid ah mu receptor, waxaa ka mid ah kappa, waxaa ka mid ah delta receptor. waxaa ka mid ah mu receptor, kappa receptor iyo delta receptor. These receptors waxay awood u leeyihiin inay sameeyaan pain modulation. So waxay leeyihiin effect ah inay keenaan analgesia, xanuunka ayay hoos u dhigayaan. xanuunka ayay awoodaa inay hoos u dhigaan. saa markaan leenahay waxaan rabnaa exactly these peptides see bay xanuunka u yarayaan. Only then will we be able to understand the mechanism of action of the opioids, which we are going to see today. So endorphins iyo enkephalins iyo dynorphins receptoradooda waxaa ka mid ah mu, kappa iyo delta. waxa ugu muhiimsanna waa mu. hadday waxaan aragnay pain pathway-ga qaabka u dhacayo, haddeer waxaan rabnaa these endogenous peptides isbeddelkay ku sameynayaan the pain pathway. isbeddelkay ku sameynayaan. So if we go back to the pathway, waxaa jiro the first order neuron wuxuu leeyahay receptor for endogenous peptides, wuxuu leeyahay mu receptor. The second order neuron isagana wuxuu leeyahay mu receptor. In the spinal cord waxaa laga helaa interneurons. waxaa laga helaa interneurons. These interneurons waxay soo deeyaan endogenous peptide like endorphin bay soo deeyaan. Waxay soo deeyaan endorphin. waxaan rabnaa isla aragno qaabka endogenous peptideska uu painka ugu sameynayo modulationka. Are we there? Endorphinkan wuxuu ku dhigayaa receptorkiisa la yidhaahdo mu laga helo first order neuron. receptorkiisa waxaa la yidhahdaa waa G coupled protein. waa G coupled protein, especially waa GI. especially waa GI. So whenever GI protein stimulation lagu sameeyo, what will happen to the level of CAMP? The level of CAMP hoos buu dhacaya. CAMP wuu yaraanaya. Now CAMP-ka markuu yaraado, alright, calcium channel-ka ayaa xirmanaya. waxaa xirmanayo calcium channel. So waxaa yaraanayo calcium-ka soo geli lahaa, hoos buu dhacaya. hadduu yaraado calcium-ka soo geli lahaa inside this nerve terminal, it means neurotransmitter iyo substance P-ga tirada la rabay lama soo daynayo. in neurotransmitter release ay dhacdo waxay ku xiran tahay the level of calcium. calcium-ka inside the neuron hadduu badan yahay, neurotransmitter release wuu badanaya. Okay, the level of calcium in the neuron hadduu hoos u dhacsan yahay, neurotransmitter release wuu yaraanaya. So maxaa u dambeyn doona release of substance P? Of course wuu yaraanaya. Why wuu yaraanaya? calcium-ki soo geli lahaa, channelka uu soo geli lahaa baa xirmayo. Then calcium soo geli lahaa inside the neuron wuu yaraanaya. Then ma imaanayo in neurotransmitter substance P in badan la soo daayo. Are you understanding? Let me repeat. maxaa dhaynay? Endorphins ayaa laga soo daynaya interneurons in the spinal cord. wuxuu ku dhigayaa mu receptor in the first order neuron. mu receptor waa GI coupled. haddii la stimulate gareey CAMP levelka hoos buu dhacaya. calcium channelka wuu xirmanaya. calcium soo geli lahaa wuu yaraanaya. hadduu calcium soo galay uu yaraado, then this neurotransmitter la yidhahdo substance P in badan lama soo daynayo. inta la soo daynayo way yaraanaysaa. substance P la soo daynayo hadduu yaraado, stimulation lagu sameynayo second order neuron wuxuu noqonaya more or less buu noqonaya. Of course markuu noqdo less, pain transmissionka loo diri lahaa higher center muxuu noqonaya? wuu yaraanaya. then waxaa yidhahdaa pain pathway waxaa lagu sameeyey modulation. xawliguu ku waday iyo intensity ku waday neuronada, pain transmissionka hoos buu dhacaya. endorphinska kaliya kama howlgalayaan first order neuron. even waxay awoodaan inay ka howlgalaan second order neuron. second order neuron see bay aga howlgalayaan. Let's look here. Anytime endorphin ay ku dhegto mu receptor, let me repeat, mu receptor maxaa leena waa GI coupled. CAMP muxuu noqonayaa? CAMP low buu noqonayaa. potassium channelka ayaa furmaya markaa. maxaa dhacaya? potassium channel baa furmaya. potassium channelka hadduu furmo maxaa dhacaya? potassium xagee buu ku badan yahay? inside. So potassium gudaha ku jira ayaa baxaya, wuxuu aadayaa banaanka. potassium positive ion is negative ion weeyaan? potassium positive ion way. mar hadduu potassium uu yahay positive ion, inside the neuron cellkiis wuxuu weynayaa positive ions. gudaha maxaa ku badanaya? negative baa ku badanaya. neuronka ma wuxuu noqonayaa depolarized mise hyperpolarized? hyperpolarized. neuronka wuxuu galayaa relax. hadduu neuronka u galo relax, any amount of substance P meesha yimaada, neuronkan inuu stimulate gareeyo ma ku adkaanaysaa mise u fududaanaysaa? way ku adkaanaysaa. haddii neuronka stimulation lagu sameeyo waa which the second order neuron, baaq loo diri lahay higher centerska uu yaraanaya. This is the mechanism of action of the endogenous peptides on the mu receptor, for example.